Hello, everyone, and thank you for joining us today. My name is Rebecca Gluck, and I am the Patient and Education Coordinator with the Ehlers-Danlos Society. It is my absolute pleasure to welcome you today to celebrate Lara's appointment to Affiliate Professor of Practice in Patient Engagement and Global Collaboration at Penn State College of Medicine. Today, as we celebrate Lara's accolade and her advocacy work for rare and chronic diseases over the past 10 years, we will hear from representatives at Penn State about what this new role is, how it will work, and why Lara was chosen for it. We will then watch an interview with Lara and the chair of our Medical and Scientific Board, Dr. Claire Francomano, before answering questions from you at home. If you have a question you would like to ask, please submit it in the Q&A box here on Zoom. There will be a session at the end during which we will answer some of your questions live. If you're experiencing any technical difficulties or require assistance during this webinar, you can email events@ehlers-danlos.com and we can help you out. Now, I would like to welcome Dr. Ma, who is the professor and chair of the Department of Medicine at Penn State College of Medicine, who will explain to us what a professor of practice is.
I'm Thomas Ma, chair of Department of Internal Medicine at Penn State College of Medicine. And I'm delighted to explain what a professor of practice is at Penn State College of Medicine. A professor of practice is an academic title conferred by Penn State University to people who meet the criteria outlined in the Penn State AC-21 academic policies for academic ranks. It is a non-tenure track faculty position, and it's intended for those who may not have had the traditional academic background that is typical of a faculty as they move through the professional ranks. The title of professor of practice is really reserved for those people who have accumulated a decade or more of high-level leadership experience in the private or public sectors outside the academy. This rank is intended to provide a pathway for a person to provide their unique background and wealth of knowledge that is of particular value as it is shared with the university's student and other faculty. The academic affiliate prefix indicates that this individual is not a Penn State employee, but rather continues their leadership work in the private or public sector where they contribute to the academic mission. As chair of Penn State College of Medicine, Department of Medicine, I am delighted to share that Ms. Lara Bloom, President and CEO of the Ehlers-Danlos Society, has been appointed an academic affiliate professor of practice in patient engagement and global collaboration here at Penn State University. Lara has contributed decades of leadership and research in the fields of patient engagement and global collaboration related to Ehlers-Danlos syndromes. She has been a lifetime advocate for patients with Ehlers-Danlos syndromes, and we are absolutely thrilled to partner with Lara, and we can't wait for her to join our team to promote advocacy and education and to advance research in this area. Now, we had 3 events that were scheduled for this spring, but unfortunately, due to COVID-19 pandemic, these were interrupted, and we look forward to rescheduling these in the future. First, I invited Ms. Bloom to present at the Department of Medicine Grand Rounds on the topic of Ehlers-Danlos syndrome and patient engagement. She has agreed to share this hour with Dr. Claire Francomano, who is professor of genetics at Indiana University. Second, the Penn State Clinical and Translational Science Institute has invited Ms. Bloom to present at Penn State CTSI webinar, which will be broadcast nationally in the CTSI network. The topic will be establishing multi-stakeholder teams to address the needs of these rare disease communities. Third, the Penn State EDS Patient Research Advocate Advisory Group, EDS Prague, and the Penn State Stretch Echo have invited Ms. Bloom to a community engagement evening, including showing of her Issues with My Tissues documentary. We have a long tradition here at Penn State of welcoming people with statue of our Nittany Lion, our signature symbol. And here I am delighted to present Lara with the statue. Unfortunately, due to COVID-19, I'm not present this to you in person, but I am delighted that I am able to present to you in virtual format. So I will be sending this lion to you, and I very much look forward to seeing you on campus and having a very productive collaboration going forward. And congratulations again.
Thank you, Dr. Ma. Next, we will hear from Dr. Boehmer, the Associate Dean for Faculty Affairs at Penn State College of Medicine, who will be explaining why Lara was chosen for this professorship role.
My name is John Boehmer. I'm the Associate Dean for Faculty Affairs at the Penn State College of Medicine. And I had the role of working with our administration to get the rank of Professor of Practice for Dr. Lara Bloom. So Dr. Lara Bloom has an interesting background in that she does not have extensive education in the area of medicine that's formal, but she has a great deal of knowledge, experience, and interaction with the community, particularly in regards to Ehlers-Danlos syndrome. It was brought to my attention that she would be happy to be involved with both the educational and research aspects of this within the College of Medicine, and we viewed that as an opportunity given her extensive background, particularly working with the Ehlers-Danlos Society. So my role was to put together a package of information that could go to the administration within the Penn State University in order to attain the rank of Professor of Practice at the Penn State College of Medicine. And there were steps that had to be taken. This is not a commonly approached rank that's used within the college or within the university as a whole. But it is very useful for people who have more practical, pragmatic experience in a specific field, that they can bring that real-world experience into our educational system and utilize that for both educational purposes and research purposes. And Lara Bloom really fit that definition very nicely. So once we got everything together, everything actually moved along very smoothly from that point.
Thank you, Dr. Boehmer. Now we will hear a few words from Dr. Rebecca Bascom, who is a pulmonologist at Penn State College of Medicine and member of the Eds Comorbidity Coalition, who will go through how Lara's position with Penn State will work. Dr. Bascom?
Now I'd like to speak for a few minutes about how Lara's position will work. And I'd like to situate her contribution and activities in the context of Penn State College of Medicine's mission and areas of activity. Penn State Health, Milton S. Hershey Medical Center, Penn State College of Medicine, and Penn State Children's Hospital have a shared mission statement and are committed to enhancing the quality of life through improved health, the professional preparation of those who will serve the health needs of others, and the discovery of knowledge that will benefit all. And there are 4 areas of focus: education, patient care, research, and community outreach. In Lara's capacity as academic affiliate professor of practice in patient engagement and global collaboration, we anticipate that she will contribute in all of these areas. In the area of education, she will be providing patient education related to EDS through connecting Penn State to the Eds Echo Program, particularly the patient advocacy, but also the clinical expertise that we will connect our clinicians to. She will educate through the CTSI webinar on how to promote patient engagement and global collaboration in working with rare diseases generally. The lessons that she has learned are applicable to many rare diseases, and our Clinical and Translational Science Institute will provide a connection to the other institutes around the country. She will, when she is visiting, be available for local lectures in Hershey to both to clinicians and to patient support groups. And finally, she will work to educate through the Comorbidity Coalition the connections between EDS and the comorbidities. In the area of research, she will continue to connect to our Penn State EDS Patient Research Advisory Group, where she will be participating and promoting research and contributing her ideas to the Penn State projects in this area. And she will also work through the EDS Comorbidity Coalition, of which Penn State is a member, to develop and implement the research agenda related to EDS and the comorbidities. Her engagement is also important to our work with PCORI. PCORI has as one of their missions having patient engagement as part of a research standard, and to have people with the condition that is under study to be present from the inception, development, implementation, and dissemination of research questions. And so Lara will continue to be engaged with Penn State in research activities. In outreach, she will help us learn how we can develop our own research, our own outreach activities, and provide advice and modeling through the EDS Society's activities. And then finally, clinical. EDS is a complex condition that involves manifestations that cross many different organ systems. And Lara is in a unique position to be aware of best practices around the world in clinical care, and she can bring those to Penn State and provide insights as we try to do a better job to take care of people with EDS. So as you can see, we have a lot of work and a lot of activities that we anticipate having a contribution from Lara in her new capacity as academic affiliate professor of practice.
Great, thank you, Dr. Bascom. Now, for the next portion of today's event, we will be hearing from Lara, Dr. Francomano, and Dr. Bascom as they answer some questions, reflect on the last decade, and give us some insight into their future plans to help improve the lives of those living with EDS and HSD.
This next section will be a question and answer period where I get to ask questions and we get to hear from two people who are very active in the Ehlers-Danlos community and also have achieved academic distinction. Dr. Claire Francomano is Professor of Medical and Molecular Genetics at Indiana University, and now Lara Bloom is Academic Affiliate Professor of Practice for Patient Engagement and Global Collaboration at Penn State University. After this question and answer session, there will be an opportunity for you to submit your questions to Lara and Claire, and so let's get started. We will focus on the last 10 years and also look ahead to the next 10 years to think about the Ehlers-Danlos syndromes and the role the society can play in advancing the fight against this difficult condition. So, Lara, let's start with you. Many people would be interested to hear how you began your career in this field. And can you tell us a little bit about how you got started?
Absolutely. So many people have heard, but I actually started in a very different way. I used to be a photographer, and that was what I did my first degree in, and that was where all my work experience was. And then between 2007 and 2009, my symptoms became much more severe. My postural tachycardia syndrome really kicked in, and I found it very, very hard to kind of carry heavy photography equipment, to stand for long periods of time. And I knew that I had to have a bit of a rethink about what I was going to do and the direction I was going to go in. And I decided that I wanted to embark on a new degree. I wanted to find an office job that would, you know, bring some excitement into my life and fulfill my ambition at the same time. And I actually decided that I wanted to be a spy, believe it or not. And so I embarked on a degree in global politics and international relations at the University of London. And that's kind of where I started going in a really different direction. And in parallel to this, at the same time, I had actually ended up going to America to seek out answers for why my symptoms were so bad and to see if I could get any resources. And I went to the Ehlers-Danlos National Foundation Conference. And I came back and I was just so inspired, and I found it so incredibly helpful. I came home and I was like, I wish there was something like this in the UK. And so I kind of went on Google, and on about page 4 or 5 of Google, I found the Ehlers-Danlos support group. And it was a very small organization run out of a little church hall somewhere in the country in the UK. And I got in touch with them, and it was run at the time by a very passionate group of people who had the condition themselves, but it wasn't very proactive. And so I said to them, you know, what can I do to help? And so at the time I was looking at potentially putting on a fundraiser event for them or something like that. And so that's kind of how I left it. And then completely unrelated, I ended up going to a gallery event with the old organization Getty Images that I used to work for. And I was sitting talking to people, and they said, you know, I'm sorry to hear you no longer work here. What happened? And I said, oh, I've got a condition you've never heard of before. And the gentleman I was talking about said, try me. And I said, I have Ehlers-Danlos syndrome. And his face completely changed. And he said, my daughter died of that when she was 19 years old. And that was the first time I had ever met someone properly, completely randomly, that had been impacted by EDS. His daughter had vascular EDS, and we were talking about, you know, our experiences and how we'd got to this point. And I said, I've been trying to speak to the UK organization, and he had too. And so he said, why don't we go together and speak to them and see what we can do? And he said, do me a favor, write down on a piece of paper everything that you would want from an organization. And I was like, well, that's easy. I'm so inspired after just coming back from this big conference in America. And I know what I've needed over the past, you know, few years since I was diagnosed. And so I scribbled everything from, you know, the big things to like having a Facebook page, having hoodies, having conferences, you know, really everything you could think about. And we went to this meeting, and I, in my way, got very passionate and said, you need to do this and you need to do that. And at the end of it, this gentleman said, I would like to donate some money. And what I would like to do is donate your salary and for you to do everything you just said on that piece of paper. And I said, hang on a minute. No. I've not had any experience doing that at all. and I'm about to start this degree, and I want to be a spy. And he said, you know, do it alongside your degree part-time, and if at the end of the degree you've done even a little bit of what's on this list, then there'll be more there for people in the UK. And that was January 2010 when I started officially as a volunteer initially, and then part-time with EDS UK, and here we are today. So it's amazing how things can change just from a chance meeting.
It's an amazing story, really. And then now, so fast forward 10 years, your appointment is in patient engagement and global collaboration. And what is patient engagement, and how do you see global collaboration happening, especially in the COVID-19 era?
Absolutely. So I think for me, you cannot answer questions and have progression bench to bedside without the patient narrative. I think the patient being engaged as an equal stakeholder reminds you of the why. It helps define the how, and it leads to much better outcomes. And without that, it's a disservice to everything that's being done, whether it's research, you know, drug trials. And I think that so often patient engagement is seen as a tick box that is done at the end of a study. Can you just read through that? Tell me if it relates to you. And it's done as an afterthought often. And it's changing. It is changing as we speak. You know, the last few years, you've seen a real increase in pharmaceutical companies, you know, lots of research studies, non-profits, all realizing the importance of patient engagement in all aspects, but critically equal stakeholders. And that's really the key that I'm so desperate to change. And it is happening. And there's some great research studies into proving the improvement of a study with patient engagement versus not. So we'll actually have evidence, published evidence as to why it's so important. And I think that's essential. And in terms of global collaboration, well, when we first started our efforts back when I was working at EDS UK in collaboration with EDNF on updating the criteria in 2015, we realized that there was a really big gap and a need for a global organization, and bringing people together to do what had previously really only been done in silos was incredible. It was just such an increase in the outcomes that were happening. And, you know, the 2017 criteria, that publication was so monumental. It was, I think there were 93 different authors in the end, and there was 18 different papers. And it's, you know, one of the most viewed downloads of papers within EDS and HSD ever. And it remains open access for that reason. And it just shows what global collaboration can achieve. And so the society was born with that in mind. And everything we do, we try and do it collaboratively with other people from the community, with other patient organizations and non-profits, with health professionals. Bringing together everyone just brings you along so much faster. And COVID-19, well, that's that has increased the need for that even more so. Whereas before those collaborative conversations started on Zoom, they usually ended in face-to-face meetings. And what this era has shown us is actually so much can be done from beginning to end through that virtual setting. And not only that, it then expands your reach, because whereas people were limited to being able to attend meetings either because of funding or physical capacity, suddenly those hurdles are removed. And so you have a lot more people that can take part and a much wider table that you can all sit around. So as much as it's brought challenges, I think it's brought a lot of opportunity too.
That's a great wide-ranging discussion. I must say, personally, I still look forward to when we're back to face-to-face engagement, in addition to the virtual meetings that we're going
I agree.
So if there are other people, let's just do a couple more questions for you I have in mind, and then I'll turn to you, Claire. But so Lara, if there are others out there listening who would like to get into patient advocacy or patient engagement, what would you recommend they do?
So I think you need to think about, there's two different ways of doing advocacy, and there's no right or wrong. So one way is that you do it as a career, and then one way is that you're doing it as a volunteer alongside something you do, and both require a little bit of different things. So I think if you're wanting to do it for a career, the biggest lesson I've learned over the past decade is that you have to learn how to tell the story of the community and not your own. I very, very rarely speak through my lens. I think I can count on one or two hands the amount of times I've done that, because you have to represent, you know, in my world, all the different types of EDS. Within those types, the different spectrums, HSD, all the comorbidities. You're not just telling your story. And I think what happens a lot of the time with advocacy and awareness work is people tell their story through their narrative, and that's very powerful and important. But if you want to take it to that next level, it's having that broad perspective. So of course, step one with anything is learning, listening, building up your knowledge of all these different areas so that you can really represent as many people as you can. That's the biggest advice. And then there's lots of ways and platforms that you can help with that education. So one example, we've talked a lot about Project Echo and how wonderful that all teach, all learn model is. And we were one of the first, in fact, we were the first to start a patient advocacy model of Eds Echo, where we realized the importance of increasing the health professionals around the world. But wouldn't it be wonderful to also increase the amount of people raising awareness within the community as well? And so that's one model, and we do, I think, 3 or 4 cohorts a year, and I would recommend checking our website, seeing if you can apply for that. There's also, for those in Europe, and I think anywhere from around the world, can apply to something called UPATI, which is something I did, which is patients training for patient engagements and research and understanding really all the parts that go into that. There's Global Genes that run the Rare University. We actually have on our website a patient advocacy section which has links to all of these different resources. So I recommend you take a look at that. But just be ready for a new norm and throw yourself into it and realize you can have a wonderful career in it. So good luck to anyone involved and interested.
Well, I know that you've met with our patient research advisory group here at Penn State, and they were thrilled to have you bring your experience to them. And actually, we now have a member who is on the patient research advisory group who went through the EDS Patient Advocacy Echo Program and learned that this was one area where she could contribute. So I think that's an example of how the Ehlers-Danlos Society work and the Penn State work have been mutually beneficial, and I think going forward there'll be continue to be more examples of that.
Absolutely.
So what about hurdles? What are the biggest hurdles that you have experienced getting to where you are now?
So I think it's a mixture of things related to funding. So when I first started in this, I was a volunteer. So I was also 30 years old, which is when you've got responsibilities and rent to pay, it's hard to volunteer. And even when that first started out, the pay in non-profit and support charities is relatively low. And so people have to really make that decision and think about whether you can afford that. And so that is a big consideration because that is something that can impact that. But then there's also the funding for an organization to run. For an organization to be able to do this global outreach work requires people to be able to contribute that funding. So I think that that's been a hurdle as well. So you're independently being able to afford to do it, and then the organization you're working for being able to afford to do the level of programming that you would like. And then there's people's capacity. So all those you work with, I would say pretty much all of the health professionals we work with volunteer their time and expertise in all times of the day and night because of the different time zone challenges. And it's remembering their capacity and working with deadlines. So that's also a big thing that has been a hurdle. And I think for me, in terms of my career path, the biggest hurdle has been preconceptions of the condition. So having a constant battle to convince people who thought they knew what EDS was to really making them realize what the reality of this condition is. And that's people in both the wider community and the health professional community. You know, when we exhibit at global conferences such as focused in GI or rheumatology, and you'll have people coming to your desk and you're set up with a very professional setup with resources. And there were doctors that would roll their eyes at the beginning because we were there. oh, this is that bendy thing, you know, why are you at a GI conference? Fast forward 10 years, and we have a line at our booths when we go to these conferences. We have doctors that come over and say, I have your homepage saved on my desktop because I have to visit it every day. And thank you so much for what you're doing. And that's a wonderful feeling, to feel like you've had an impact in having that shift in people's, I guess, respect and validation for this important condition, and the understanding of how multisystemic it is.
So you mentioned professionals or being at conferences. So let's turn to Claire now and have you contribute your perspective as a health professional in the field, caring for people with the Ehlers-Danlos syndromes. What do you see as the most impactful changes over the last decade?
Well, I have to say, really, under Lara Bloom's leadership, the Ehlers-Danlos Society has just become a tremendous force for advocacy and science, and a force for advancing the lives of people living with Ehlers-Danlos syndromes and hypermobility spectrum disorders. It's just unimaginable to me, really, the accomplishments that she has put forward over the last 10 years. It's really been tremendous. I believe funding research for basic science to social science right across the spectrum of the scientific arena is a really, really major contribution that Lara has facilitated through the society. We've got over $1 million in grant money going out this year to support science, to help us understand the underlying problems that cause really such challenges for people living with EDS and hypermobility spectrum disorders. I think convening the international consortium in 2016 was really a pivotal moment, as Lara mentioned, bringing those clinicians and scientists together and the advocates together from around the globe to address the current state of knowledge about EDS and sort of put forth a research agenda, like what do we know and what do we need to know at this point in time. That was really, really important. And the publication of those 18 papers in 2017 was the next touchstone, because as Lara mentioned, those articles have really served as a reference point for much of what has followed. I've got two other things I think have been very, very important contributions. And one was the Comorbidity Coalition, which all three of us worked on to make that happen. And that's brought together clinicians, scientists, and advocates from a wide range of patient advocacy groups to first define a common research agenda and then to develop guidelines for management. I think this has really got the potential to make huge, huge contributions to the field. And then the last item is the Eds Echo Program, which I just cannot overstate the importance of that. It's been such a privilege to be part of it, because bringing specialized knowledge about the diagnosis and management of EDS to clinicians around the globe, and now expanding to specific areas such as the allied health professions and educating patient advocates, this really truly has the potential to improve the quality of life for people living with EDS wherever they are in the world.
You know, I think that the Comorbidity Coalition that you're mentioning, I remember the first meeting of that, and that was convened in Hershey. Penn State was kind of a host of this, and we had no idea where it was going to go. And I think, Lara, you and Claire both helped convene the group, the Comorbidities, and people have been learning from each other. At the end of that 2-day session, where people with the health conditions, clinicians, scientists all spoke together, there was a list of 70 research topics, that all of which seemed like good topics. And then there was this interest and a voting and a process. and 3 questions sort of emerged as the top questions. And those are all being worked on right now and are in things that are incredibly impactful for people. So I think I endorse what you're saying. It's been a lot. Let's have some questions. That I'm going to pose a question, and maybe Claire, you could take first swing and Lara second swing. So Claire, what do you see as the biggest priorities over the next decade?
This is a tough question because we, as you said, there were 70 important questions that emerged from that Comorbidity Coalition. Excuse me. But I think identifying the genes that underlie the hypermobile type of Ehlers-Danlos syndrome is really, really an important priority. And we have the Hedge study, which is ongoing under the leadership of the society to try to accomplish that. I think finding a treatment that will mitigate the risk of arterial events for people living with vascular EDS is another really very, very important priority. And finding ways to improve pain and fatigue for people living with EDS. I think these are 2 of the elements that really impact people's quality of life to just a tremendous degree. And if we could figure out how to get those better, we would really be going a long way to improving people's quality of life. And then finally, just understanding the physiology behind the multiple comorbidities, comorbid conditions that we see in people living with EDS and HSD. So we can start thinking about developing rational therapies for these conditions. We're just really at a point right now where we don't understand them very well. And we need a lot more science to understand the underpinnings of these comorbid conditions.
Lara, how about you?
So I think the dream for the society from day one was for us to enable and facilitate all of those things that Claire just mentioned to happen. So for me, the biggest priority is sustainability and funding. You know, I want to get to a point where we can ensure that we have, you know, millions of research dollars every year for our scientific community that have had almost none prior to, you know, 2018, 2019, and make that something that we can consistently rely on, so that that is regular grant rounds and giving. And for the organization to have that sustainability and longevity, to have the staff team that are needed to keep the lights on and keep that work going. I think there's always this mindset in nonprofit that everything's done with volunteers or should be done with volunteers, and actually you need highly skilled people to carry out the work that's needed to run a global organization, and that costs money. And so just ensuring that that is there and that framework is there is a huge priority. And more global representation, I think, in terms of translation. So we started our translation strategy this year formally, where we're translating things into about 4 languages this year. We aim to do, you know, 6 next year, 8 the year after, and so on. And I would like to get to a point where every language is translated. And I think the problem that, again, people don't think about with translations, you think you can just press Google Translate. But when you're talking about very important medical information, it's absolutely essential that's translated accurately and allows for cultural differences where something might be translated literally and then just makes no sense in another country. So it's a huge undertaking. And something else that's so close to my heart, and I think to everyone I know who is part of the organization, our whole staff and board, is something that has come out of the last few weeks of what we're experiencing around the world, and that is the creation of our Breaking Down Barriers Coalition. Now, at the beginning of this year, we launched our Breaking Down Barriers campaign because we were aware of how many hurdles and barriers people face getting access to healthcare all around the world, and whether that's based on race, gender, disability, where you live, all of these things have an impact. And we wanted to try and understand what they were, and more importantly, try and change those things and break down those barriers. And obviously what's been going on at the moment has really increased the need for that. And we wanted to do more. And because of the success of the Comorbidity Coalition, we looked at that model And we said, we can do this, the Breaking Down Barriers Coalition. So we have just launched that. We're inviting people to join that. We're going to have people from our community represented, other patient organizations, other health professionals. It will be modeled much the same way as the Comorbidity Coalition. And we know how successful and what worth has come out of that. And I know the same will come out of this coalition, so that we can really work on equity and justice for as many people as we can around the world. So that's what the priorities are right now. I mean, there's a very long list, but we're short of time, so I'll stop there.
Well, so then let's, speaking of, that's a great segue into what I was thinking of next, which is anytime you think where you want to go, then I think anticipating challenges. And so those can be planned for, overcome. So Claire, what do you see as the biggest challenges to achieve the priorities that you were outlining? Finding the gene, understanding the physiology, understanding the multi-system nature, having healthcare systems that can address that without care fragmentation, if I could add that on the list. So what do you see as the challenges?
Well, you know, in addition to the funding issues, which Lara mentioned, and of course that's paramount. We need the funding to do all of these jobs. I would say the biggest challenge fundamentally is the complexity of the problems. We're talking about very, very complex medical situations. And in terms of the gene hunt, I think it's become really obvious now that there are likely to be very, very many genes, and it may be that there are multiple interacting genetic factors. It really seems quite clear now that it's not going to be a single gene or even a handful of genes, because with the work that's been done so far, we would probably know them if that were the case. In terms of the vascular EDS issue, treatment is complicated, right? We're dealing with blood vessels that are ubiquitous. They go everywhere in the body, and it's not as if we can just simply replace an enzyme. We're talking about a structural element of the connective tissue. So that's a very, very complex situation, as is the pain and fatigue. There's so many potential underlying causes. So really understanding the root cause of the comorbidities, I think, is going to be very, very important to developing rational strategies for us.
No, you were talking about the fact that in the vascular EDS, the vessels are everywhere, and there can be these areas of weakness that can be catastrophic. It's true also that heart disease, again, it's began with understanding a very local problem that could show up anywhere, a number of places, in the heart, in the legs, different places. But once that was understood, then things like anti-cholesterol medicines, anti-platelet, things that we completely take for granted now, were not at all obvious to people when heart disease, became the focus of research. So I think that the vascular EDS, very important. And I think I endorse your focus on the biology, because then you know how to intervene for prevention. So Lara, how about you? Challenges to achieving priorities?
Well, I hate to just keep saying the same thing, but it's got to be funding, because without it, we can't do any of this, and that's, to me, what the biggest problem was. Up until the launch of the society, there was no funding, large-scale funding in any way for the science, for the research, for advocacy, for putting events on, for getting global reach, for education. It just wasn't there. National organizations were doing a great job of doing what they can, but it was almost like, and this is a British-American difference, you say Band-Aid, I say plaster, but it was like putting a plaster on a big wound. And what we want to do at the society is start to really stitch up and heal that wound. And that takes a lot of funding, a lot of time, and capacity. So those two things, funding, capacity, are the absolute core ingredients to anything that we need to change and want to change. Research requires lots and lots of funding. The funding to bring together these researchers in meetings, dialogue, conferences, the international symposiums we have every 3 years, Echo, the educational platform, we have 3 members of staff working on that. It all costs money and capacity. And so if that's there and that can keep growing, then the sky's the limit, because what we have as an annual budget is what, big cancer and heart organizations and asthma organizations and these, much more known conditions have in like a month's budget. And we, have that for a whole year. So we're tiny in the grand scheme of things. And we need to grow. We need to break out the kind of hamster wheel of our community and let the world know about these conditions, how important they are, because I'm sure with natural history studies, epidemiological studies, that we're going to really start to understand the true prevalence of this and how many people could be impacted and how many people will therefore start to realize how important these conditions and the comorbidities are.
I'm going to hop off the list of my questions because, Claire, I think one of the questions is, do you think that the lessons learned from EDS will be applicable or will be beneficial to people with other conditions, for example, with what we learn about pain for EDS? Is that, do you see that might be translated? Or is this just something that is for this rare disease?
No, I think there are going to be many lessons for common conditions from what we learned from the Ehlers-Danlos syndromes and HSDs. Pain, of course, the musculoskeletal pain, there's a lot of overlap with fibromyalgia, for example, and I think once we learn how to address musculoskeletal pain in EDS, it'll provide a lot of information to people living with fibromyalgia. There's a lot of musculoskeletal complications that we see in EDS that may provide models for the complex diseases of aging, such as osteoarthritis and osteoporosis. And I think there is huge potential that there will be translation from what we learn in the EDS community to the wider human condition.
So, Lara, what do you see as the community's role?
So I think that people don't realize the strength in how much every individual can do. I think helping us get out a consistent, collaborative message is key. So people are using the same terminology, the correct terminology. Helping us, of course, fundraise and raise awareness. The impact of everybody taking on board their responsibility to raise awareness is unbelievably powerful, especially in the day of social media. We just have ended Awareness Month, which is every May. And we were very nervous because it happened during a global pandemic. And how do you get the importance of EDS and HSD out there when the world is living in lockdown during this very scary time? And it was one of our biggest awareness months to date. We were just blown away. And every single day, all the social media feeds were just putting out there what this is like to live with day to day. And the engagement it just blew up, and it was incredible. And so if everyone was doing that all the time, of course, Awareness Month focuses our attention on that, but the power is immense. And I think if everyone realizes, if everyone did their little bit, we would get there so much faster. And working together, being kind, being mindful of what everyone's going through, and really helping to get that message out.
Yeah, being kind is a lovely and very powerful thing, both in our people that are experiencing the pandemic and the limitations right now. I think become acutely aware of how a limited life limited by health concerns, can be very challenging. And people with EDS have said that in some ways they think they were better prepared for the pandemic because they were accustomed to living with restrictions and to having to navigate the world. And I thought that was a poignant comment that I heard. Claire, how about you? What is your biggest hope as a health professional for this next decade?
So my biggest hope is that anyone with a diagnosis of Ehlers-Danlos syndrome of any type or any of the hypermobility spectrum disorders can live a highly functional and pain-free life by the end of this decade. I'm going to just put that out there.
That's
Amen.
And so then, global collaboration in one of the focuses of Lara's affiliate academic professorship appointment here at Penn State. How important do you see global collaboration being in driving research and progression forward?
I just think this is absolutely key because EDS is a global issue. There are patients on every continent, and we have valued collaborators all around the globe who are working tirelessly on these issues. So it's really critical for all of us to be able to work together to identify and achieve the highest priorities and just get it done.
Lara, where would you love to see the EDS Society in 10 years' time?
Well, I would love to see us giving out at least $2 million in research every year, at least, translating into as many languages as we can. And I think the most important thing is reducing diagnosis times so that people are diagnosed as soon as their symptoms appear. The average diagnostic odyssey right now is 10 to 12 years, and it's just simply not good enough. And then that, of course, has such a ripple domino effect on their quality of life, how many comorbidities, the severity of those comorbidities. And I think if we got it right earlier and we got that diagnosis right, we would see such a difference. So that's hugely important, and anything the society can do to make that happen is very important. And then, of course, ensuring that people are offered the long-term management and care they need to be able to sustain that quality of life. Because it's, often you're given, for example, some physiotherapy for 6 weeks. Well, with a chronic health condition, that's not very helpful. You need it sometimes every week for the rest of your life. And so working out that chronic piece of this puzzle for healthcare globally is essential, I think. And also including that offer of mental health support as needed, as a given whenever anyone is diagnosed with a chronic or rare condition, which includes the EDS and HSDs. I think that's so important and not offered currently. And I would love to see that as a standard.
You're talking about a chronic condition, and I'm reflecting on how other chronic conditions, diabetes, asthma, hypertension, heart disease, how disease state management has been a cornerstone of reducing the impact of those conditions on a person's quality or improving the quality of life living with those conditions. So I think the idea of disease state management for all the forms of EDS and the hypermobile hyperspectrum disorders would be a wonderful goal. Claire, we're getting to the end. Just a couple more on my tick list. As a health professional, how valuable is it to have patients engaged from bench to bedside, in your opinion?
In my opinion, it's absolutely crucial. As clinicians and scientists, we just need to know what issues our patients are struggling with and what are their top priorities. And these should be our top priorities as well, because otherwise we're working in a vacuum. I think the patient engagement is driving the science now, which is so wonderful. And kudos to Lara for bringing this about. I think it's an absolutely wonderful turn of events, and will help us be more useful to our patients in the future.
So Lara, Penn State, we at Penn State are very pleased that you've met the criteria for this distinction for an academic affiliate professor of practice. And it's very much our hope that you will continue your active participation in promoting patient engagement and advancing research through global collaboration in this area. Thank you all for listening to our conversation.
Thank you. I think now we can open up to questions from those listening.
Sounds good.
Great. Now we would like to answer some of your questions. So I'll start with the first one. What measures are you putting in place to reach those who traditionally haven't been able to engage with the society? And this question is for you, Lara.
Thank you. So I touched on it, I think, in the Q&A a little bit. We're really keen to try and reach outside of our current community. And I think it's so hard, you know, so often you walk down the street, you might tell someone your condition and they've never heard of it. And so we're doing a great job of raising awareness within our bubble, I guess, our world. And the million-dollar question is, how do you reach outside of that? And we're working hard to do that. One way is we are pushing the translations. So we have a strategic plan that, of course, is very much down to funding, because translations are so much more expensive than you would ever imagine. And we need to do, the more languages that we can provide, the more reach we will have. And so much education, materials, resources for EDS and HSD have been in English. So there hasn't really been that ability to stretch out and reach the people that we know are living with these conditions. So I think that's one way. I think the other way is by offering all of our events in a virtual setting. So of course, because of COVID-19, we've had to move our summer conference to a virtual platform. And I think the last time we checked, so we've got over 700 people registered, which is just outstanding. And I think 75% of those registrants have never attended a society event before. And to me, that just shows how many people are not able to come in person and how many more people you get to reach when you do it virtually. So as hard as this has been, as I said earlier, this has given us great lessons and things to take forward. And I hate to say that there are silver linings when it comes to such a tragic global pandemic, but I think lessons coming from that so that you can do better and learn from it is a wonderful thing.
Great, thank you. And the next question is for Dr. Bascom. Is there any way to advance treatment by finding a link between different diseases and system effects?
Mute.
So Dr. Bascom, I think you're on mute and I'm not sure your video is turned on. So you just need to unmute and turn your video on if that's okay, because we can't hear you.
Okay, I think I can
There
see,
you are.
You do now? Okay. All these buttons, it's the technology. So the question is, how can we do science to look at this multi-system condition that are the Ehlers-Danlos syndromes? Well, in a way, anything you do will move this forward. Anything we do will move it forward. One approach, for example, is to look at prescription plans. So if you take a group of people who have EDS and a group of people who do not, and you look and see what medications their clinicians have prescribed to them, that's one of the ways to get a look at the burden for people with EDS. So instead of saying, I wonder if they are on medication X, you can say, what medications are people on across their lifetime? How does that change with certain key periods of time, such as during adolescence or during menopause? That's one example, I think. The Comorbidity Coalition is the other example I'd like to cite. I'll just give these two. What the Comorbidity Coalition does is it brings people together that are accustomed to looking at things with a very specific viewpoint. And then through conversation, people realize the commonality of their perspectives, and then that drives the research forward. Other thoughts, Lara?
No, I think that's good. I think as well, the question was interested in how you could kind of find a link between different diseases and system effects. So learning from, you know, perhaps fibromyalgia or other conditions, and how we can translate that to EDS. And someone coming from outside of the EDS world, I think it would be interesting to hear your perspective.
Yeah, so
can't see Becky. There you are.
Yeah, my background is in pulmonary and critical care medicine, but actually way 30 years ago, I was in a laboratory and I was studying the mast cell and the basophil. And so I have been accustomed to thinking about mast cell activation as something that happens in the lining of the airways. And so I have a fair amount of knowledge about bringing those local effects under control. And I think very much as I hear about EDS, I also think back to those long ago experiments. I think there are just many connections in science, things where one area of endeavor connects to another. But more than anything, it's listening to the stories and the experiences of people who have the condition. And it has to start with that listening in order to think about how to move forward.
Thank you.
Thank you.
Next question is, does the Society help with fundraising events? This is for Lara.
Yes, we would love to help with as many fundraising events as you would like to do. So we have an outstanding development team, and you can get in touch with them anyway. On our website, there's links, and I think their email address is giving@ehlers-danlos.com. And there's lots of support and resources and encouragement and ways that we can advise, lots of different ideas. So absolutely, and we're so grateful for anyone that is willing to do that. And I think what people don't realize is even doing, you know, a small bake sale or a dress down Friday or whatever, you know, there is out there, every single dollar, pound, euro, all contributes to making that difference. So there is never too little. It all adds up together. So whatever you can do, we would be grateful for.
Thank you. The next question is for Dr. Francomano. Please, can you tell me about Eds Echo? Is it just for doctors?
So the Ehlers-Danlos Echo program was originally designed for professionals who are caring for people with EDS and HSD. And those initial series of lectures and discussions had physicians, physical therapists, occupational therapists, speech therapists, naturopathic doctors, professionals of all different types have participated in those. And as you've heard from the discussion earlier, the Eds Echo program has now been expanded to include an advocacy program. So there is one program that is specifically dedicated to people living with EDS who are interested in serving as advocates for the condition.
Great, thank you. Okay, the next question is for Lara. Aside from this, what is your biggest achievement so far?
Good question. I think it has to be the moment I crossed the finishing line of the London Marathon in 2011. That was such a huge personal achievement for me. I also raised over £10,500 for EDS UK. The documentary issues of my tissues came out of it. And it was something I never thought possible. And I hope it shows people how much your quality of life can change with some changes to your kind of self-care and the holistic approach, because I started that from a very, very deconditioned place, and I was able to really change what I could do when I started that. Even the thought of walking a mile was impossible because of pain and fatigue, and to complete the 26.2 miles, although I do not recommend that for people with EDS and HSD, it was an incredible personal achievement.
That is a wonderful achievement. The next question is for Dr. Francomano. What research opportunities do you think will be possible in the future for those with EDS, HSD, and the multiple complex comorbidities?
So I'm assuming the questioner is asking about participation in research endeavors.
Yes.
Is that the question? So the first and biggest effort that the Society is sponsoring right now is the Hedge project, which is designed to find the genes underlying the hypermobile type of Ehlers-Danlos syndrome. And anyone who has a diagnosis of hypermobile EDS, according to the 2017 criteria, is invited to join us in that study. And the way to do that is to sign up for the global registry at this point in time. There are quite a few studies that are currently being sponsored through the Ehlers-Danlos Society. And the information about those is available on the Society webpage. And I would say people who are looking for research studies involving Ehlers-Danlos syndrome should know about the website that's called clinicalresearch.gov. I think that that will, if they go to that website and put in the Ehlers-Danlos name, then they'll find studies that are specifically targeted at Ehlers-Danlos syndrome.
Dr. Bascom, do you have anything to add to this question as well?
The website that I go to is clinicaltrials.gov, I think is.
Oh, clinical trials, that's correct. That's correct. Clinicaltrials.gov, yes.
And you can look with any search terms. So if you're interested in vascular EDS or if you're interested in a particular comorbidity, there's a search function that you'll be able to work through. I think the other thing is that continuing to send your things that are of interest to you to the Society, which accumulates a list of good ideas and of patient priorities. And from that bubble up these opportunities.
Thank you. And a question was submitted that is related. Are there any updates on when the Hedge study will be completed?
Yes, so we are going to be making an announcement imminently. It's obviously a study that was reliant on enrolling 1,000 people from around the world with hypermobile EDS, and COVID-19 has made that impossible. So we have got to almost half of our enrollment target, and we initially thought we were going to pause enrollment until when travel was possible again. But we actually are looking into options and ways that we can continue enrollment in a virtual way by still adhering to everything we need to scientifically for the study. And we're going to be making an announcement about this, as I said, in the next week or two when we have all the information. It's obviously being discussed with the IRB, and we're doing everything formally that we need to ensure that the study is done in the best way possible. But I think, again, it's a wonderful example of how a challenge has actually allowed us to look at an opportunity, because this way we may actually reach many more people around the world that we may not have had the capacity to go to in person. So watch this space. Good news coming.
That is great news. Thank you. Next question. What are the first steps into advocacy for someone who is just starting out?
So I touched on this a little bit in the interview, but I think I would ask yourself what kind of advocacy you want to do. So do you want to do this as a career as I have? Do you want to do it because you want to tell and share your experience, which is absolutely needed in the world to teach medical students and professionals? So I think first deciding what you need to do and how you want to do it, and then that will lead you down different paths. So I've done a lot of training, and some of it, most of it, in fact, I've kind of done on my own in my own time to train myself and give myself more skills. There are some fantastic podcasts, webinars, books and resources out there that you can look into. If you type my name into most social media platforms and LinkedIn, you can reach me and I can give you some lists of some names and recommendations. And we have on our website, if you click on patient advocacy, a whole section which links out to places like Rare University with Global Genes, UPATI with Uraudis, our patient advocacy Echo program that we do. So there are lots more opportunities coming day by day. So lots of opportunities for everybody, no matter what level you wanted to do it at.
Great. And Dr. Bascom, Dr. Francomano, anything to add to that?
Well, I think that one thing is to just figure out who you are, what you do well naturally, what you like to do. So I don't think advocacy is about doing something that's uncomfortable for you. I think it's trying to understand what you're naturally good at and to see how that connects you to the many faces of advocacy. In one group, somebody talks about what's a my-size job. So I think look yourself in the mirror and figure out what's a my-size job. It might be writing War and Peace, a major novel. It might be making a phone call or sending a card or a letter. So figure out what a my-size job is and how that connects to your interests in EDS advocacy.
Thank you. Great advice. Okay, next question for Dr. Francomano. How do you handle health professionals who dismiss EDS and POTS and do not recognize EDS and comorbidities as real diseases?
This is a challenge. I think particularly for patients who are trying to obtain health care and dealing with people who are not familiar with the many comorbidities and with the issues that people with EDS grapple with on a day-to-day basis, it is very challenging. And I think the main thrust of people's efforts should be to try to find professionals who are at least open to learning about these issues and to reaching out to specialists who have the knowledge that they need to take better care of people living with EDS. So one of the great benefits of Eds Echo is that patients are able to tell their providers about Eds Echo. And we've had many people who've participated in Echo because they've had a single patient who has EDS or HSD and wanted to learn more about how to take better care of that patient. So finding someone who's at least open to learning, I think, is the main key.
Thank you. And our final question for now is for Lara. Lara, you have so much to share. When are you going to write a book?
Well, it's funny you say that. I have actually been writing a book for the last couple of years. And I started writing this actually many years ago. And I kind of got stuck around my teenage years because they were hard for me. And I didn't really know how to get past that, how to structure it, what the theme should be. And I connected with a ghostwriter in Los Angeles called Caroline Ryder, and I've been working with her on this book now for a couple of years. And what's been wonderful is it's allowed me to still, because I love writing, I've written for many years, so she's given me a fantastic pace and structure of the book and allowed me to kind of fill in all the details and write all my memories and experiences. And so again, this was something that was we were talking with publishers at the beginning of the year, and COVID-19. So I think it will be delayed, but I'm really excited to say I hope it will be out very soon. So yeah, watch this space.
That's wonderful. I'm sure we are all looking forward to reading it. Okay, great. Well, thank you. Before we say goodbye to you all, we would like to share with you a wonderful video from the Ehlers-Danlos Society board members, other professionals, and members of our community sharing their congratulations and what Laura's advocacy efforts and leadership of the society has meant to them. We hope you enjoy it.
Congratulations, Professor Bloom. Lara, the Board of Directors is very proud of you, not only for this very well-deserved honor you're receiving, but also for leading the Ehlers-Danlos Society. You have consistently put yourself out there and shared your story and shared yourself, all in the name of raising awareness for EDS and HST. I hope this professorship gives you an even bigger platform to do the job you love.
Congratulations on becoming a professor, Lara. I'm so happy to hear this news. You have been amazing. You have always been sending out positive, powerful messages to the group, and that kept me going. Thank you so much for being my inspiration.
In 2012, we met for the first time on a train from Ghent to London after attending the EDS conference. He was so tired, but had this amazing dream of getting all the EDS specialists around the world to work together. Over the past 8 years, I watched how your amazing hard work, dedication and passion became this uniting force that got us where we are today. It's been a real pleasure working with you, and congratulations on your amazing achievement.
Congratulations, Lara. You've made an outstanding contribution to the communities affected by EDS and HST, communities whose issues are often misunderstood, misdiagnosed, invisible and sometimes debilitating. You have really changed and enhanced the quality of life for so many people, whether that's through advocating for greater public awareness, spearheading new research, educating the medical communities and empowering patients themselves. You really are an inspiration. So this professorship is very well deserved. Congratulations again.
Wow, thank you so much. That was so wonderful, and it really meant the world. Thank you to everyone who made today possible, to all those at Penn State who have been involved, to our board of directors, our scientific community, and to you all. The last decade wouldn't have been possible without those at EDS UK that believed in me, gave me the opportunity to do this, for those at EDNF back in 2015 who did the same. And had the same dream and believed in what we could do. The last decade wouldn't have been possible without any of our dazzle either. So thank you to everyone for being part of today. The global pandemic meant it couldn't have been in person, but actually it's meant that so many family and friends and colleagues over the years have been able to join in a way they wouldn't have done. So thank you, and bye-bye for now.